Hey, just got done lifting today, and I just wanted to share with you because we experience this with our clients all the time, especially if they're over the age of 70 or even people younger than that, often struggle with muscle soreness. So basically, what happens after you work out? What is appropriate? What's okay and what's not? And oftentimes, this is generational and cultural because we grew up with what we grew up with. Formal exercise was around during certain times in history and not in others. So oftentimes muscle soreness and our response to muscle soreness can be a big factor. The way that our brain interprets it is a big factor. So I want to touch base on that. Basically, the definition of muscle soreness, or delayed onset muscle soreness as we call it, is basically the soreness that happens 12 to 72 hours after exercise. That's basically the window that's appropriate. And the reason for this is it's the immune system response to the muscle breakdown. This is a normal, positive part of muscle development, and it is expected. And you do want muscle breakdown when you do resistance training, and especially during the lowering part of the contraction or the eccentric part of the contraction. That's when that tends to happen. So 12 to 72 hours after the exercise, that's normal muscle soreness. If you go beyond 72 hours, then it tends to be more problematic. That's when you know you overdid it. So if it's 5 or 6 days later and you still have the muscle soreness, then you did too much. But that's all right. Learn from it. I've done that before, less often than I used to, but occasionally I still might do something like that. And so then I learn from it. I did too much if it's 5, 6 days later. So 12 to 72 hours afterwards is normal. This is different from lactic acid, what people often hear about. Lactic acid is basically the drop in the pH level or the increase in acidity in the muscles when you do anaerobic exercise, or basically when your muscles are working so hard they can't take in oxygen. They're working so hard, so intensely that they can no longer really use oxygen as a fuel source. So what you get then is an increase in the acidity in the muscle, and so an increase in the lactic acid. So basically what happens is you get that burn, and that can usually last for, for a couple hours afterwards, but it gets flushed away pretty quickly. The muscles in the body have to take care of that acid. It can't continue to live in the body. The body flushes out. That is different from delayed onset muscle soreness, which is the muscle soreness you get 12 to 72 hours afterward. And then the question is, especially if you're taking care of an aging parent, or if you are over the age of 70 or 80 or 90 or wherever you're at, these things are normal and they should happen with strength training. Now, the difference is if you're in your 80s and 90s, how much muscle soreness is worth it? Or is it worth getting so sore that you can't walk very well? And that's, I think, the distinguishing factor with a younger population of people versus an older population of people. With the younger population of people, if I lift legs and I can't walk tomorrow very well, I'm okay with that as long as it doesn't last, again, more than 4 days after the workout. I'm okay with that. If my leg all of a sudden gives out, then I'm okay with that because it's muscle soreness, and for a younger person, that can be okay. If you're 85 years old and you have so much muscle soreness from working out that your leg gives out, that's more problematic. So you just don't want to exercise that intensely. But a little bit of muscle soreness is normal. That's a very normal response, and it's appropriate even when you're over the age of 70, 80, 90 years old. So you do want that muscle soreness even when you're over the age of 70, 80, 90 years old. So I want to reassure you of that's normal. You do want that. That's a normal part of strength training, and it's a great part of the muscular development. Now, the question might be, will this ever get better? And the answer is yes. The more you exercise, the more you strength train, the more your body gets used to the exercise, then the less sore you tend to get, or you have to work out a lot more hard, or you have to strength train a lot more intensely in order to get that same type of muscle soreness. So it does get better as you do it and as you continue to do it. Now, if you stop doing it for a while, then it comes back more quickly. And so again, that's very normal. Great information, and a question we often get, or a problem we often run into for people, if you have an aging parent taken care of, or if you're in their 70s, 80s, 90s, this is very useful information that you're gonna need to know. And if you like information like this and the rest of our YouTube channel that you've been consuming, hit subscribe. That way that you can continue to get this information and more people will be able to get it as well. Now, I've talked in the past about delayed onset muscle soreness and how this is a normal response to exercise, even for people in their 70s, 80s, and 90s. So the other question is, how do you get the legs less sore or the arms less sore? So very basic things. Yes, you can do, alternating between hot bath and cold bath and ice bath and all this stuff. And, most people aren't going to want to do that. What are simple things that we can do? So very simple. One, you can do a lesser load or a lesser resistance of the exercise that you already did. So if you did sit to stands with weight, then you can do sit to stands without weight. for instance. And so you do just less intensity, less load than you did before with a similar exercise. Of course, stretching can be very helpful. General exercise and cardiovascular exercise and walking can be very helpful as well. Just get everything going, get everything moving. Moving more is better when your muscles are sore rather than moving less. If you move less, if you sit more because your legs are sore, then your legs are going to stay sore for longer or whenever is sore. So exercise, cardiovascular exercise, a bike, walking, whatever it might be, stretching, especially long duration stretching, and then a lesser resistance on the exercise that you already did that caused the soreness in the first place.